So
but it's also a presentation.
It's a presentation now, and the poster session, is it the title plus 3 slides? Okay. So in the literature, there are 2 series that have been published. In the literature, there are 2 series have been published with the results of the shockwave lithotripsy using the Dornier Doli Lithotriptor. Several investigators have also looked for prognostic factors that will identify patients at risk for failure after shockwave lithotripsy. In the late 1980s, it was suggested that if a stone was more dense on KUB X-ray than the lumbar vertebrae, they were at higher risk for failure after shockwave lithotripsy. 2 series have been published lately correlating that stone density on CT imaging was associated with with success rate after shockwave lithotripsy. In a small series published in 2002, they demonstrated that high-density stones greater than 1,000 Hounsfield units was associated with a poorer success rate. We hoped in this study to substantiate these findings, but also we want to look at our own results with shockwave lithotripsy using the Dornier Doli Lithotriptor. We then wanted to test whether successful treatment can be predicted by a preoperative CT scan. We performed a retrospective chart review in consecutive patients over a 1-year period undergoing shockwave lithotripsy for the first shockwave treatment of their renal stone. All stones were between 4 and 20 millimeters in diameter. All patients had follow-up imaging in order to assess success. They had either a CT scan or KUB at a 3 to 6 week post-op period. In order to determine stone density, patients who had preoperative CT scan imaging were assessed. We used 3 regions of interest in each stone to determine stone density, and this would be reported as an average Hounsfield unit. The stone density, this is an example of a CT scan of a 5 millimeter stone where a consistent area was used to determine a Hounsfield unit density in 3 separate non-overlapping regions, and this was then averaged to give us an average stone density for the stone. Patients then underwent shockwave lithotripsy on a Dornier Doli Lithotriptor with up to 3,000 shockwaves per stone. The following is a summary of the results. We had 85 patients in our series. Our success rate or stone-free rate was 42%. 46% of patients had stones that were unchanged on follow-up imaging. 12% of patients had stones that were fragmented, but the fragments were greater than 4 millimeters, and most of these patients had further interventions. The characteristics of stones that were looked at on preoperative CT imaging are summarized in this table. We had 76 patients who had preoperative CT imaging, and again, the stone-free rate was similar in this group. 39% of patients were stone-free. In each outcome group, the stone size was similar statistically. In patients who were rendered stone-free, they had a lower stone density that was statistically significant when compared to the group that had residual stones. In patients who had no change in their stones after shockwave lithotripsy, 40% of these patients would have a high-density stone. Interestingly, patients who had fragmentation of their stones had an even higher rate of high-density stones. But as expected, patients who were stone-free had a low rate of high-density stones. Only 16% had stones over 1,000 Hounsfield units. We theorized that stones that were high-density may be predisposed to fragmentation if there was a greater degree of variability in the density within the stone. And we looked at the degree of variability between this subset. But in our study, we did not show that there was a greater degree of variability or standard deviation between these stones to account for their fragmentation. In order to demonstrate whether stone density would be predictive, would have a predictive value after shockwave lithotripsy, we divided the patients into two groups: patients who had a low density stone, less than 1,000 Hounsfield units, and those with a high density stone, greater than 1,000 Hounsfield units. Low density stones had a 50% stone free rate. This was significantly greater than patients with a high density stone, stones over 1,000 Hounsfield units, who only had a 20% success rate. In conclusion, in our results on the Dornier Doli Lithotriptor appears to be less than that reported in previous series, but this may be because of our short follow-up period. As well, we imaged many patients with CT scans, and this is different from previous series which used KUB X-rays for follow-up. However, stones rendered stone-free have a relatively lower density on preoperative CT scans, and this appears to be associated with a better or an improved outcome. In other words, stones with a high density, Hounsfield units over 1,000, had a poor predictive value for successful treatment, only 20% in our series, and further studies will be needed to further substantiate this finding. That's it.